Hello, my name is Elizabeth Edmiston, and I am a Health Professions Education Evaluation and Research Advanced Fellow at the Cleveland VA Medical Center. Welcome to my learning module titled Facilitating Learning and Success as a Quality Improvement Coach. From this lesson, you will learn the different roles of a coach on a quality improvement team. You will also be able to describe the VA Quality Scholars Coach Model and how it applies to coaching quality improvement teams. Finally, you will be able to recognize potential challenges that may arise while coaching and some strategies to help you overcome these barriers as you coach. Quality improvement is the framework used to systematically improve care. Unfortunately, as we proceed into professional careers in healthcare, a multitude of quality gaps in our system emerge. The gaps can range from a local primary care office problem to a system-wide multi-hospital issue. Interprofessional healthcare workers and students are required to gain competency in quality improvement during their course of education, and many participate in their first quality improvement project in a learning setting. Supporting these learners and other healthcare professionals who have a range of quality improvement experiences is the task of the Quality Improvement Coach. Coaches for quality improvement teams can have many names: practice coach or facilitator, improvement coach, and improvement advisor, to name a few. Typically, coaches are quality improvement experts who have advanced knowledge and training in quality improvement who help teams navigate healthcare systems. Coaches also are expert communicators and have worked on teams extensively. Coaches are aware of the operating and organizational policies at their institution. The VA Quality Scholars QI Coach Model is derived from IHI's Model for Improvement and uses Delansky's Improvement Worksheet as a structured assistant to the coach. Following the steps in the worksheet, each coach can ensure proper direction and thoroughness while guiding teams through the systematic QI process. As you can see here, Delansky's Improvement Worksheet uses 8 steps for quality improvement teams to complete a project. We are now going to go through each step from a coach's perspective while using a common topic for quality improvement projects: increasing flu vaccine administration in a primary care clinic. Imagine that you are a known quality improvement expert at a local hospital and are approached by one of the advanced practice registered nurses in the primary care clinic. She begins telling you that flu season started 2 months ago and she's been encountering a large number of patients that still have not received their seasonal vaccination. She asked some of her other colleagues in the clinic, and they are all noticing the same problem. She has come to you to ask if you would help her with a quality improvement project, which of course you agree to. According to the VA Quality Scholars QI Coach Model, you begin with the preliminary step of encouraging team building and stakeholder meetings. Your team may be busy recruiting necessary members. However, as a coach, you must ensure the team is not only interprofessional, but also includes relevant stakeholders to assist with the process. Consider recommending that the team complete a stakeholder analysis. As a coach, you may also need to assist the team on securing a project champion. At this step, coaches should ensure team members are effectively communicating and holding regular, effective meetings. Once the team has been selected, step 1 of the model is honing team focus and aligning with leadership. Teams may have a general sense of purpose, but need to confirm they all agree on a feasible and narrow enough project. As a coach, you may need to meet with your team to help clarify or hone this aim. Does the aim relate to STEEP principles, safety, timeliness, efficiency, effectiveness, equity, or patient-centered outcomes? Ensuring all team members agree on and are clear about the aim of the project help to ensure project and team success. Finally, as a coach, you must ensure the project aligns with leadership and quality initiatives at your institution. Step 2 involves assisting with evidence collection. As a QI coach, you may need to assist the team in reviewing the literature and obtaining information on best practices. For example, your flu vaccine team meets to discuss their findings. The literature states that providers should expect that around 50% of patients in their area will have received their flu vaccine by 2 months after the start of flu season. Team members immediately start discussing potential ways to increase vaccine uptake in the clinic. As the QI coach, you remind the team to continue gathering baseline data and to proceed through the improvement steps in order to stay in scope and on track of the project. Fostering systems thinking and QI tool usage is step 3 for a QI coach. Often teams assume that they understand a system from their personal experience. However, the coach may need to emphasize objectivity to team members and encourage team members to interview all key stakeholders. Coaches also assist teams in choosing appropriate QI tools to analyze system data, such as Pareto charts, cause and effect diagrams, and flow charts. In our flu vaccine project example, your team has been collecting baseline data on how many patients have received the vaccine that day, and refuse a vaccine. They also collect data on reasons why patients refuse the vaccine. As a coach, you then suggest and assist the team on creating a run chart and a Pareto chart with these findings. Step 4 of the model is confirming your team's SMART aim and project feasibility. Remember, a SMART aim is specific, measurable, achievable, relevant, and timely. The QI team discusses the project aim thinking about feasibility and contextual barriers, and comes up with a relevant aim during the weekly project meeting. You suggest they add a percentage increase of vaccines they wish to achieve and a date that they wish to achieve this goal. Next, step 5 is orchestrating measure definitions and feasibility of measured data collection. As a coach, you may need to help the team plan which measures they will collect and how. You also will need to ensure that your team not only collects outcome measures, but also process and balancing measures. Many inexperienced quality improvement teams need help thoroughly examining the way interventions may affect the system they are trying to change. Facilitating team change idea brainstorm is step 6 in the VA Quality Scholars QI Coach model. As a coach, you will facilitate reflection of all change ideas and encourage use of an impact effort matrix for change idea ranking. You may need to remind your team to refer to the team's gap analyses and literature review for evidence-based change ideas. The last step in the model is directing the team's PDSA, or Plan, Do, Study, Act cycles. You must direct your team through the planning and implementation phases of the PDSA cycles and encourage data examination soon after the start of each cycle. You will also need to encourage and assist with timely and necessary alterations of each PDSA cycle they choose to complete. Lastly, you may need to coordinate a completion plan for each change idea they plan to keep, such as creating a new standard operating procedure or organizational policy highlighting the steps and details of the new process. Despite following the QI Coach model, you may find that your team still presents with some challenges. One common challenge QI coaches may encounter is that your team relies on you to do too much of the work and falls behind on deadlines set by the team members. To combat this problem, you must resist the temptation to do too much work for your team. One goal of the QI coach is to facilitate learning. Teams may need to make mistakes as part of the learning process. If this becomes a problem with your team, a good strategy is to meet with the team to facilitate discussion about the way the project is moving forward. You can help the team break down large project components into smaller, achievable ones with due dates. Another common challenge QI coaches encounter is team dysfunction. If this occurs, the coach should help the team review and negotiate their roles, responsibilities, and ground rules. The coach may need to attend additional meetings or even engage in conflict resolution. Also, the coach may need to help the team rethink project scope within given constraints. Finally, don't forget to celebrate small wins. Lastly, here are a few general tips to help you succeed as a QI coach and ensure your team's project goes smoothly and successfully. Watch for learners who jumpstart the process and remind the team to follow the QI process step by step or the worksheet. Review the project's next steps and deadlines at the end of each meeting. Insist the team members practice presentations and get feedback regularly. Finally, make sure the team is using a shared drive for documents. This concludes today's presentation on facilitating learning and success as a quality improvement coach. I hope this information is helpful as you start your journey as a quality improvement coach, and good luck as you begin coaching quality improvement teams.